Hello, everyone. Welcome back to the podcast. My guest today is Rachell Dumas. She's a registered nurse whose dedication to helping others stems from her own journey through significant medical challenges, which include 8 miscarriages and a stillbirth. She transformed this pain into a nonprofit that provides support to women and families facing the emotional and physical trials of infertility and pregnancy loss. Rachell is especially committed to advocating for women in marginalized communities, ensuring that they receive the compassionate care and resources they deserve. Thank you for joining me today.
Thank you for having me, Pamela. It is an honor to be on this podcast.
I'm so glad our schedules hooked up, linked up.
Yes.
Okay, so let's kind of start at the beginning. You have a medical background, and that medical background combined with some of your health challenges leads us to your nonprofit. So let's talk about your medical background and the health challenge.
Yeah, absolutely. So I am a registered nurse. I have been a trauma nurse or everything but maternal care. I had maybe one pregnant patient on the trauma unit one time, and we called OB with a quickness because we just are not trained to treat pregnant women, which is another issue that we can have a whole podcast session about in itself. But yeah, throughout my nursing career, I made a point to get as much experience as possible just so I can go into informatics, so I can work on workflows and different things in the hospital that needs significant adjustments to improve healthcare. But I would have never fathomed that I would become the patient that I became during
Okay.
the journey.
All right. So let's transition into your journey. What year did this start?
Absolutely. So my pregnancy journey started in 2018 when I did an at-home pregnancy test after going to work, and a coworker was like, "You look pregnant." And yes, I was offended by that because what does that look like? I didn't have a pudge or anything. I'm like, "What are you talking about?" She said, "You look pregnant in your eyes." So people know, people know. So I was like, "What is she talking about? Let me go just take a test because I'm not preventing pregnancy, but I'm not trying to get pregnant." And I was pregnant, but at the same time, I was bleeding, which was another reason I didn't think I was pregnant because I was bleeding. But I went to the OB and they did a vaginal ultrasound, and I found out that I was pregnant, confirmed that I was pregnant, but also confirmed that I was having a miscarriage. So my first pregnancy ended in a loss. But the thing about it is, he reassured me that this was a normal part of pregnancy and that, in fact, I would go on to have a healthy baby if I got pregnant again.
Mhm. I think doctors say that as a reassurance because you're feeling like it's the end. It's the end of the world. How am I going to get past this? I think doctors routinely say that as
Yeah.
an assurance.
But it's not good because you're guaranteeing something that may not be, true, which in my case, that was far from the truth, far from
Right.
the truth.
Okay, so
So,
that was your first. You ended up having more.
yeah. So in 2020, I was at work this time in the operating room, and I had swollen breasts, and I felt weird, and I took a pregnancy test, and it was super pregnant. It was super positive. So I was bleeding again, and I'm like, okay, this is abnormal at this point, right? I need to go to the ER this time. Let me just go to the ER. And when I got there, to my shock, I was pregnant with twins. I could have fell off the bed because who how did I get pregnant with twins? And the doctor reassured me that the babies were fine, but there was what's called a subchorionic hemorrhage. And when you get pregnant, the baby implants into the uterus if it's a healthy pregnancy. And that can sometimes cause bleeding. And if it's enough bleed, it could cause a sac of blood. That is a subchorionic hemorrhage. Typically, the body absorbs it and you're fine. But he said, please follow up with the OBGYN and just make sure everything is okay. By the time I got to that appointment with the OB a few days later, the bleeding worsened. I had excruciating 10 out of 10 pain, extreme nausea and vomiting. I was sick. I was sick. And she did an ultrasound, reassured me that everything looked well, and sent me home. I'm begging for morphine or something because the pain was that bad. And it made me feel like something was wrong with me mentally. And it made me second guess if I'm even having these symptoms, but they were very real. And so real that I'm in and out of the OB's office and the ER 2 or 3 times a week with these symptoms. And at 13 weeks and 3 days, I lost one of my babies.
Hmm.
So after that loss, she did an ultrasound, everything was fine, and then my symptoms went away. So I'm thinking, okay, well, maybe it was the loss that was happening, or
Right.
maybe that subchorionic hemorrhage caused that loss. But whatever it was, my symptoms were good. I had a baby left, and I was optimistic, so much that I allowed my friends to throw me a gender reveal. So they came over. I'm ready to celebrate. I wake up that morning and I'm soaking wet. And here's where a lack of education comes in. I'm thinking I urinated on myself. I'm like, okay, let me change the sheets. You know, it happens. I'm pregnant. The baby's getting bigger. You know, it happens. And then a few hours pass. My friends are setting up for the gender reveal. I go to the bathroom to urinate, and the baby falls out just in the toilet. I am devastated. I have no words. And the music was so loud that nobody could hear me just wailing and screaming in the bathroom. I had to gather myself to go and tell somebody so they can call my husband who wasn't home. And so I could go to the ER. And I go to the ER. It's 2020. They're like, nobody could be in here with you. I don't care who it is, even your husband. So I had to go through this horrible process by myself. And I get to the ER and I tell the doctor what's happened. I'm crying. And the doctor asks, how do you know you were pregnant? The same ER I've been to probably 8 or 9 times during this pregnancy alone. The same ER that had the chart with all my medical history on it asked me why, how do I know I was pregnant? And I asked her, do you want to see the baby in the toilet? And she said, yes. I showed her the picture and she said, oh, that's a baby. As if I was lying, as if I wanted to be in the hospital on the day of my gender reveal, saying that I lost yet another baby after my OB and this ER told me numerous times throughout this pregnancy that everything was fine. That is when I knew something was seriously wrong with my body.
Okay. So, a couple things I want to talk about. You said you knew something was seriously wrong with your body,
Mm-hmm.
but earlier you also said you were second guessing yourself.
Right.
I want to try to hone in on your state of mind when you feel like you something's wrong with your body,
Mm-hmm.
you are second guessing yourself,
Right.
and this is actually the third time that this has happened.
Right. So there's a term called medical gaslighting. And it's when you know that you're very much experiencing these symptoms, that something is very wrong, that you have a very valid concern, and you go to your healthcare provider and they're telling you nothing is wrong with you. They're not listening to you and just being dismissive. It's medical gaslighting. And as a result of me being medically gaslit, I lost 2 kids, 2 babies.
Wow.
And it causes this psychological warfare, so to speak. You know, it makes you think that what you're feeling isn't real. So you try to back off. You want to believe your doctor. That's what they're there for. And you go to these professionals because you don't have the training and experience as they do to treat you and diagnose you and give you quality care. But then when the very person who is supposed to be doing these things are failing you, where do you go? Who do you turn to? What happens? Miscarriages, pregnancy loss, and sometimes the loss of mom.
Wow. I want to back up just 1 minute, but you do have medical training.
I do.
Um, and you still felt this way. You were still treated this way. Did any of your providers know that you were a trauma nurse?
Some of them did know. I don't go into doctor's appointments saying I'm a nurse because at times I feel like it's very irrelevant, right? Because if I was if I was the type of provider that I needed, I would just stay home and take care of myself. If I had the instruments and the medical equipment and all of the things that I needed to take care of myself, trust me, healthcare costs way too much for me to go somewhere when I could do it myself. But I
Exactly.
can't. I'm a
Right.
pregnant woman, and I started off as a trauma nurse. I worked in OR, education, different specialties, but never maternal health, never labor and delivery, mother baby, or postpartum or high risk. So I don't have the knowledge base. I didn't have the knowledge base that I needed to, one, take care of myself, and two,
Right.
unfortunately, to advocate for myself like I really needed to do.
Okay. So, all in all, there would end up being 8 pregnancy losses.
9. So I had 8 miscarriages and a stillbirth.
Okay. Where was the stillbirth in there? Was that the
Yeah.
last? It was
So
the last. Okay.
it was not the last, actually. It was number 6. So that was number 3. I had 2 more early miscarriages at that. But after that ER visit, I went to the OB to follow up, and she diagnosed me with cervical insufficiency, which means
Okay.
the cervix, which dilates towards the end of pregnancy and baby comes out of, dilates prematurely once the baby is heavy enough and the baby comes out. So that's usually at the end of the first trimester, first beginning of the second trimester. But I kept having early miscarriages as well. So there was something wrong. Never told to go to a specialist until I met with a manager of mine, and she recommended that I see a reproductive geneticist and a reproductive endocrinologist. I saw both of them. Nothing was abnormal genetically, but the reproductive endocrinologist was the first person to investigate those early miscarriages by doing a bunch of lab work, and doing a procedure to check the shape of my uterus to see if that was possibly a reason for the losses. And she put me on 2 medicines to help me get to the second trimester to get what's called a cervical cerclage. A cerclage is a suture that goes around the cervix to treat cervical insufficiency. It keeps the cervix closed so that I can carry full term. I get it removed around 36, 37 weeks because I can't go into labor with it. Hopefully the baby will just come out pretty, smoothly. So after 5 miscarriages, I found out that I'm pregnant, doing home pregnancy test, no bleeding, no symptoms, feeling good, emotionally distraught and scared, of course, after 5 losses. And I'm followed by the reproductive endocrinologist. I take the medication she gives me. I make it to the 13 weeks where I can get this cerclage, the procedure. I get the procedure. That doctor tells me come back in 7 weeks. Now I've had 5 losses at this point. I'm advocating for myself to come back sooner because I need monitoring. I don't trust
Right.
being away from you for 7 weeks. I don't trust it. I don't know why you would, but she was adamant and said no. And I believe her. That was the first specialist I had seen. I'm like, she knows. She said she's seen it multiple times. I'll be fine. So I thought I'd be fine. She said if I wasn't fine and it was failing, we would know. I would have excruciating pain and I would have significant bleeding. So I'm looking out for that. I'm very vigilant at this time. 7 week passes. I feel amazing. So I go into the appointment and I'm like, okay, ready for my 3D ultrasound. These are milestones for me. I'm 20 weeks. That's the longest I've been pregnant. Mid ultrasound, that ultrasound tech just walks out the room and said the doctor will come back. And I immediately felt remorseful, felt regret because I knew something was wrong.
Mm.
That doctor comes in and tells me your cerclage has failed. And I said, you told me I would have these symptoms. What are you talking about? I feel great. Nothing's happening. I don't have pain. I don't have bleeding. Can we do another cerclage? Can I be on bed rest to try to save this pregnancy? And nonchalantly, she told me you can go and deliver. And I asked, wouldn't the baby die? And she said, yes. At 20 weeks, yes, unfortunately. So at that point, I'm enraged at this point. I just storm out. I'm sorry, I'm not doing that. I storm out. I called everybody I knew and told them what's happening. I said, we need to find a doctor. After doing some research, I found out I could have had a transabdominal cerclage, which is higher than the vaginal. And I could have gotten that way before then. And it stays in forever. But I found a doctor in Dallas, Texas, Dr. Falwell at Texas Health. I had to shout him out. I will say his name because he was my saving grace throughout this. And he calls me on his cell phone. We're texting. I'm sending him different, things he's asking for, records. And he said, I need you to fly out here. I said, Dr. Falwell, there's a baby coming out of my vagina. Like, you want me to fly? Are you sure you want me to fly? He said, yes, this is the only hope we have. We have to fly. We have to pray nothing happens. I'm like, okay, I'm flying. I flew out that night at 10 o'clock. And I made it there, and they rolled out the red carpet for me at that hospital. From security to intake to the nurses to everybody, the OR team, everybody. Everybody knew I was there and why I was there. And after the 3-hour procedure, the 3-hour surgery took 8 hours because the baby was literally coming out at this point, and they had to push the baby back in. The surgery was successful. I woke up to everybody like cheering, and we're pregnant. But then once anesthesia wore off, contractions started. And they gave me so many different medicines to try to stop it. Nothing worked. And I was in labor for 30 hours. And at the end of that 30 hours, my water broke. And that was it. I had to go back to the OR, get both of those cerclages out. I got an epidural, and I gave birth at 21 weeks on July 17th. And that was my stillbirth. And I probably was the most depressed I've ever been at that time. But still happy that I fought for it.
Yes, yes. Let's talk about the depression and anxiety. I would think that kicked in right after the first one?
It did not. After the first one, I was like, well, he's saying it's normal. This happens. I wasn't really planning or trying to have a baby. I rationalized that very well. I really genuinely didn't feel anything bad after that. I felt a little confused. Like, is it really? Do people really just go around having miscarriages like he casually is saying? I don't think the depression started until after the loss of twins. The depression and the anxiety. I didn't even have anxiety after the first. It was definitely after that twin loss when I was realizing something is really wrong with me. My body is failing me, so I thought.
Okay. All right. So there was a miscarriage after this stillbirth, correct?
So after the stillbirth, I had 2 more miscarriages. But before that surgery, he promised me that if this doesn't work, I'm bringing you out and you don't have to pay for anything. I'm going to put in that cerclage again, and you're going to be a mother. And true to his word, that November, I was in Dallas on a table, and he put in that cerclage. I had 1 more early miscarriage, and on May 2022, I found I was pregnant, followed by the reproductive endocrinologist, graduated to a different maternal fetal medicine doctor, made it to the 3rd trimester, and then on 12/30/2022, I gave birth to a 4-pound, 15-ounce baby boy, who is now a 2-year-old pot-belly toddler who is very demanding, barely speaks English.
Okay, but 4 pounds.
4 pounds, 15 ounces, yes.
Okay.
I had to deliver early due to health issues at the end of my pregnancy.
Okay. All right. So we move from that to your nonprofit. You now have a nonprofit. Tell us about your nonprofit.
Yeah, so I took a hiatus from pregnancy for 1.5 years and tried to rest in between mom, being a mom, of course. And I was sitting here thinking like about everything I went through. I stayed in counseling since this process, and I go every week, and I was like, I really want to do something to prevent anyone else from going through what I went through. I think I did it big enough for everybody. I've had enough loss for everybody at this point. And I came up with a light after 9, and I named it so because I had 9 pregnancy losses, and I finally got my light, which was my baby. And the other light was that I overcame this very traumatic experience. And there were times I thought I wouldn't make it. I physically thought I wouldn't.
Physically and emotionally.
And emotionally. I just didn't think I would make it. And after that experience, I was diagnosed with PTSD, anxiety, and depression, and night terrors, and had to be put on medication for those things for a while. And I started Light After 9, And I started to become a maternal health advocate, and I wanted to be the voice for those who felt powerless, like I did so many times. I felt like I was on the other side, and I finally had regained the strength to be able to speak up and to talk, and to also give women the things that I wish I had, which is grants, because it's expensive. I could buy a Bugatti with the amount of you know of money I owe still. The hospital, mental health resources, which was very big in my journey. Finding doctors and specialists that's high quality. We have a mom to mom mentorship program, a momtorship, because if you've been there, done that, it's so nice to help somebody who's going through that process, and vice versa. If you're somebody who's going through it and you don't see that light, which is hard to see that light, it's nice to have a therapist, your doctors, but it's also nice to have somebody to pull you up and help you come, get to where you're trying to go. So, and we also get care baskets to the hospital, and we are partnering with hospitals to better their care. We're doing post-discharge care management because so many balls were dropped after they leave the hospital. Like there was, at the end of my pregnancy, my oxygen was going low. I was in the ER in the waiting room for 8 hours one time, and a doctor falsely documented that I was fine, despite of my heart rate being in the 180s, which it should be 60 to 100, and my oxygen levels being in the 80s, which should be 95 plus. And I advocated for myself to get a consult by a pulmonologist in the hospital, and he put me on oxygen. I never received the oxygen and had to deliver at 36 weeks.
Wow.
So when Rachell Dumas gives us an F in Georgia, higher than the national grade for preterm birth, it's because of things like this.
Okay, say that again. Rachell Dumas.
Yeah, so Rachell Dumas gave the United States a D for their preterm birth report card. Georgia got an F.
Overall, the whole country.
The whole country. That's how bad it is. Georgia got an
But
F.
Georgia has an F.
An F. And I wonder why, right? I wonder why. I wonder why. We were number 2 for the longest time for the maternal death rate.
I'm in Virginia, and I remember when Virginia was number 1.
Really?
Yes, it was some years ago. It was the reason we had Medicaid reform back. Wait,
Mm-hmm.
not what Clinton did. I mean, years ago, because I'm old.
Yeah.
Yes, I remember when Virginia, if they were not 1, they were number 2.
Yes.
It is what led our WIC program, our Women, Infant, Children program. I remember
Mm-hmm.
that.
Yeah. And honestly, all over, Black women are 3 times more likely to die of preventable pregnancy related complications than any other race. It's insane.
I want to talk about that because my question to you is, do you think the race disparity was an issue when you're showing up with these pregnancy issues? Did
Absolutely.
you sense that? Did they say that, or did you just sense that?
So no one is going to outright say, I'm being racist towards you right now. There's a thing called implicit bias. You don't even realize as a healthcare professional, and sometimes you do, but a lot of times you don't even realize you have these biases, right? And in order for you to recognize them, one, you have to be in situations where your biases come up, but 2, you have to do self-evaluation, and 3, you need training, because there are times where you don't even realize what a bias is. Just like sometimes we don't realize certain things are happening to us and we need to advocate. You don't realize that you think that Black people don't experience pain because all of your training has,
Training.
has taught you that Black
The gentleman who is known as the father of gynecology got his training on slaves.
mm-hmm.
And until I think it was the 2000s, there was a statue of him outside,
Yeah,
you know? Yeah.
yeah.
So
There's
that bias is not so much that Black women or Black people don't feel pain or
right.
that they're exaggerating, one or the other.
Exaggerating. Yep. So with that, what does that mean for us? Is that we will not receive the treatment that we need and deserve and is rightfully ours, like our white counterparts will. We come in with the same exact issue. We're told what we're feeling. isn't as severe as we say it is, where our white counterpart is saying, oh my goodness, you need morphine. Our black counterpart will get Tylenol. We're both in
Yes.
10 hours in pain. And for a perfect example of this is when I went to the ER and a white doctor, comes and say, oh, you shouldn't even be down here. Go to maternity triage. Maternity triage sent me back down to the ER. I was ping pong between the two units until I was like, stop, just stop. At least evaluate me to see what's going on. And she, with an attitude, mind you, was like, come on. She put a blood pressure cuff on me, a pulse ox to measure my oxygen and see my heart rate fluctuate. She had me walk around the unit. I barely could speak to her. I was so out of breath. My heart rate went up. My oxygen went down. And she documents patient vital signs normal, no issue. So as a healthcare professional, we look at the documentation of the previous healthcare provider to steer treatment. So if she said that, and I didn't go up and advocate for myself to say, no, look at this, watch me, put me back on the monitor and watch what she saw, and they saw that, then my treatment could have been delayed, or I could have not got treatment at all. I could have died. Who knows what was wrong? Then they wouldn't have been prompted to do further evaluation until I spoke up. And I put the pulse ox on. When I went back to maternity triage, I walked around and they were watching it in real time happen. So much that I advocated for a pulmonology consult and he put me on oxygen, which we know I'll never receive. But things like that.
Right.
Things like that.
Because that example there is not merely thinking that you're not feeling pain because you've got the numbers right there in front of you. That's something totally different.
Right. Right. This isn't subjective. Like pain can be very subjective. This is
Right.
very objective. You have
Right.
the
You have
modalities
data.
attached to me and you're watching it fluctuate and you're blatantly lying. You're blatantly falsely documenting that that's not what it was.
What should a woman do when she feels that she's not being heard by her doctor, um, and or that her doctor is lying?
Right. So it's quite a few things, right? Advocacy, I love preaching advocacy, but you can't be an advocate for yourself if you don't have the knowledge base, if you don't have the education. So it's so important to have that education. But sometimes we just won't have it as soon as we need it. So when I was diagnosed with cervical insufficiency, or when the doctor told me to just go deliver my 20-weeker, I didn't know about the different treatment options. That's why I'm begging her and asking her, what else can we do? I wish I had the knowledge to say, no, I need a doctor who can put a transabdominal cerclage, so we could try, I wish I could have said that, instead of
Right.
going, having to call my village and figuring this out and fly to Texas. That is insane to say back, by the way. But try to get as much education as you can. If you can't advocate for yourself, there are so many organizations out here who are very well versed on the options that you have and the things that you're going through and been there, done that, and advocate for their patients. Ask for a second opinion. If you can, leave and go to a
Mm.
different doctor. You do not have to stay with the same doctor. And a lot of us get comfortable and don't want to move, don't want to, transfer records and all that. But depending on what you're going through, it can be life or death. And
Right.
transferring all your records can seem minimal after you lose your life. It is.
Wow. What are some signs or red flags that a woman who has gone through pregnancy loss might need some more help than she's getting, might need more support?
Right. So if we're talking about just treatment overall and not being heard, if you're saying the same thing to your doctor, if you're telling them about different symptoms, if you're advocating for yourself and they're being dismissive, that's a time you might need to move on and get further help. If you're at home,
Because I want to stop, because even if you're wrong, even if you're dead wrong, even if what you're facing is A, but you think it's B, a medical professional should be able to relay that to you without you feeling like you just fell off a turnip truck.
right, right. At least
There's
tell me
basic
why.
respect there. Yes.
Exactly. At least tell me why I'm experiencing. So in my mind, I can process it and at least tell me all my options so I can I can, choose the
And
best
the
one
an
for
right. And the answer shouldn't be, I'm the medical professional. That's why.
right. It should be. It
It shouldn't
should
be
be.
like just because I said so.
It should be. My grandmother, who is like my mother figure, didn't even tell me stuff like that. I'm the parent. That's why, even she explained things, reason why she was doing that. And we need that in healthcare because one, if things get worse, we need to know when to come back to you. Two, we need to know what's next. We need a plan of care. And three, I need to know if I need to switch doctors. So, I need to know if I need to see a different specialist or a different one of you, whatever specialty you are, doctor you are. But then it's our right as a patient to know what's going on with our bodies. And we don't always know that until we go to the doctor and they're telling us. So the amount of dependency that we have on our healthcare providers is just astronomical.
Right.
It's scary too, right? It's
And there's a
scary.
dependency, but there's also in our communities, people of color communities,
Mm-hmm.
there's dependency, but there's such distrust there as well. You think about Tuskegee, you think about
Yes.
people want to take your organs and this,
Yep.
that, and the other.
Yes. It
So
is.
I'm thinking that just muddies the pot.
It does. Then you add gaslighting. Then you add getting treatment that's inequitable.
Hmm.
Then you get all these maternal health disparities that you're exposed to repeatedly. All
Right,
of this makes you distrust your provider. Then you
right.
add, them telling you one thing or telling you everything is fine, and then you have multiple miscarriages after you're fine. Why would I trust you after that?
Exactly. Okay, so we talked about red flags when you're in the doctor's office regarding your care, but what about once you're home? You've been discharged, you've been sent home, you're in bed, you're recuperating. What would be some signs emotionally or physically, financially that you're sliding down a slippery slope and we should probably reach out to an organization like yours?
Yeah, absolutely. So a couple of things. If one, that's why it's so important to have a plan of care. You should be discussing with your doctor what's next, whether it's coming back if symptoms are worse, following up regardless because you went to the hospital, whatever the case may be, or you have some type of issue going on that requires close follow up. So you need to stick to that plan of care. But then if you didn't have a plan of care or you don't trust that plan of care, and your symptoms are not resolving and you're feeling these issues and you're not and they're not being addressed, you need to talk to your doctor. You need to go to a different doctor. Also psychologically, right, there's times, we have depressive moods, we have anxiety, we feel overwhelmed, but if it's getting to a point where it's interfering with your activities of daily living, or you being able to be a mom, a wife, to be able to work, to go to school, things like that, then you really need to seek a professional to help you with those things. You could really seriously have a problem that may need further treatment. you know um, we tend to ignore mental health a lot, especially Black women. We like to do everything for everybody else, make sure everybody else is fine, right? And we're suffering, and our plight is often silence, whether it's on our own accord or because we don't feel like we have the safe space to talk about it, or we feel boggled down with all our other responsibilities to speak up about it. But we need to really pay attention to what's going on with us. And throughout the pregnancy journey, you're having such a hyper experience mentally, physically, all of these things. Sometimes it's easy to be focused on all the other things going on with our body that we tend to mask how we're feeling.
Right.
I 100% recommend, even preconception, going to see a talk therapist, because whether you have a cookie cutter journey or a journey like mine, pregnancy is a lot on your body, on your mind, on your relationships. Everything changes and you're nowhere near the person you were before. So I would just say, even prophylactically, just go and see a mental health provider just to do check-ins.
So in your case, let's talk about the support that you had, your support system, your husband, or do you have family nearby? Do you have friends that you could reach out to?
Yeah, so my family all lives in New Orleans. I just stayed out here after Katrina. I came to Atlanta August 2005. And this is where I evacuated and ultimately stayed to go to college, become a nurse, build a family. And it was just me for a while and my friends who are my family. And then I got married. So I had my husband, and I did have his family to a certain extent. And despite of that, when you're going through a pregnancy journey, even remotely close to the one I had, it's a lot on both partners. And our partners tend to not pay attention to what's going on with themselves mentally because you're technically the star of the show. But if you're trying to rely on your partner and they're not in a place where their mental health issues are addressed, then you're in it by yourself. That
Right.
actually happened to me and unfortunately led to a divorce because it
Mm.
kept cascading and that never got treated.
Right.
And then for myself, I'm going through it mentally and physically, and these are very traumatic physical events that I'm having. But after that loss that I flew to Dallas with, I went to see a talk therapist, a Black woman who I still see every Thursday. And I also saw a hypnotherapist right before I had got pregnant with my son because I had given up and I really needed something to help me stay afloat on this pregnancy journey because I finally got the surgery that I needed and I had to exhaust all options to see if I could finally become a mom.
Right.
So I tried hypnotherapy and I had 3 or 4 sessions. That's really all you need, or all I needed for this particular issue, and it worked.
Hmm.
And I'm so grateful that I was able to recognize that I was not myself. I was very depressed. I was very anxious. I definitely had PTSD symptoms, rightfully so, from all the losses that I experienced. And I needed help more than just meditation
Right.
and
More than talk therapy.
more than talk there. I needed more. And I'm so glad that I got that.
Mm. Yeah, yeah. I would think that hypnotherapy unlocked something
Yeah.
that had taken root in there, a certain thought process. Right.
Yeah. At some point I thought I would never become a mom. I thought I wasn't worthy of it. I had this tremendous guilt behind being pregnant after that loss. Why are you trying to get pregnant or keep getting pregnant rather, knowing you're going to lose the baby?
Mm.
We know the baby is not going to survive. So why do you keep doing this? And hypnotherapy helped me unlock whatever um, motivation I needed. It gave me permission to try again. It gave me permission to forgive myself. It gave me permission to be okay with my journey not being cookie cutter like I thought it was going into it.
Right.
And it gave me permission to grieve those losses and also cope with them
Right.
health, healthy way.
Right. Not be the strong Black woman.
Yeah, because we love to compartmentalize. Like I am a master at compartmentalizing.
Right. Right.
There was time I had lost at work and I was just typing, taking care of the patient. Are you okay? Are you sure? I think we should do a psych consult. I'm over here like, trying to do a psych consult with somebody. I'm over here actively miscarrying, talking to this patient. So
Yeah.
we already do that as women. Black women, we do it. And now I'm a nurse. My whole career is only solely to help others. So I have it bad. I have it bad.
Wow. So your organization, A Light After Nine, is that local? Is that nationwide? Can someone listening or watching in California go to your website and get some kind of help or contact you or your people, your team?
Absolutely. That is nationwide. We are virtual at this point. We are integrated into certain hospitals and would love to be physically everywhere, but we're virtual. So California, Texas, Virginia, Louisiana, I was about to say New Orleans. We're a little different from Louisiana. But everybody can find us on www.alikeafter9.org. We're also on social media if you want to professionally connect. I'm on LinkedIn, Rachell Dumas. We're on Facebook, Alike After 9, Instagram, Alike After 9. We're on TikTok. I don't even know what's going on with it.
Do we have TikToks? We don't know. Like we didn't
On
have it
there.
Saturday. We might have had it
Right.
Sunday.
I saw somebody put TikTok died and rose on the third day. But we're on there. I don't know if it's going to be there, but we're there. So anyway, we wanted to make it very easy for birthers, for moms in their villages to reach out to us, because you don't always feel like sending an email. Sometimes you just want to send a DM, a text, a call. You
Yes,
just don't
yes.
have it in you, especially when you're
Right.
going through a high risk pregnancy, to go beyond the Call of Duty. And granted, beyond the Call of Duty could be making a call. A DM just might be quick. So
Right. That
have
might be all you can handle. Exactly. We're
that
not
might
trying to
be
do
it.
grammar and full sentences right
Right.
now.
We're not.
So,
This
but let
DM
me
help.
ask you this. In the help, this wonderful help that you give women, are you ever triggered? Have you ever had a case where it takes you back?
Yeah. So I talk about my story a lot. I do a lot of podcasts, and we have some articles for major magazines and things coming out. And I do have to think about this over and over. It's almost a broken record for me. And in the beginning, I was triggered, and I didn't even realize it. And it's crazy how you still, even after all this time, sometimes you don't even see it in yourself when you're triggered. And I didn't anticipate being triggered for some reason. I felt like after that year and a half of rest, for some reason, I was naive to think that I was completely okay and healed. And thankfully, I'm still going to therapy every week, and I'm able to work through that. And I'm better than I was when I started. But sometimes, if I reflect on it long enough, I'm like, man. At first, it was like, did this really happen? Where was I? Where was I when this was happening? And now it's like, man, that really happened to me. This is my story.
Mhm. Now, I have read on your website, you speak a lot about resilience.
Mm-hmm.
Sometimes that's a buzzword, but resilience means something else to you. Tell us what your definition of resilience is.
I hate that word. If you talk to my therapist throughout the years, I told her name is Dr. Johnson. I love her. I'm like, Dr. Johnson, I'm tired of being resilient all the time. And because when you're resilient, that means you've been put in a situation that forces you to be.
Mm,
And I kept being in these situations where I was forced to be resilient, to make it through adversity, which is resilience. But I hate that word because we wear it as a badge of honor, and other people give it to us, right? It's usually bestowed upon us. You're resilient after they found out what you went through, and that I guess you didn't commit suicide or, hurt yourself or whatever, that you're still standing after that. But to me, I never wanted to only be resilient. I wanted to be greater than that. I wanted to thrive. I've always been a high functioning, overachiever, type A type person. So resilience to me is a bare minimum space to be in after trauma. And I want everybody to realize that resilience is just the bare minimum and only the beginning of
right.
your growth process after you've been through this, because there's more after that. And granted, trauma takes you out sometimes. It can take you out. So I don't want to minimize that experience to getting to that journey to getting to resilience. But I don't want you to think that it stops there. There's still much more. And after that, it's positive. I've never been through a trauma or adversity. I can say never that I haven't had this glow up after.
Mm.
I have not.
But
Throughout
you
my
have to know that getting through
no,
it isn't the goal. It's the
you
getting through
have
and
to know,
keep going. Right.
right. At this point, trauma is almost like a challenge for me. I'm like, oh, I'm in a trauma again. I've had a lot of traumas through childhood. Unfortunately, that was rough. I had to make it out of New Orleans. It was just a lot. So now when I'm encountering a trauma, I'm like, all right, that means this amazing glow up is about to happen, and it's always big. It's always big, and I want others to see that. But in order for me to even view it like that, you have to go through and recognize that mental space that you're in and change it, and it's hard. It's hard.
Yeah. Yeah. It's hard to think this is not normal because we're thinking this is normal.
Yeah.
This is our baseline,
Yeah.
but it's the getting beyond that and the growing. And
Right.
like you say, the glow up.
To glow up.
How old is your nonprofit? When did you start it? What year did you start it?
I actually just started my nonprofit in October of this past year. So
2024?
we're still in this infancy. And since then, I've had so many endorsements. We're partnering with marginalized. I'm going to be partnering with Huggies for webinars and education, PSI, Postpartum Support International, these global companies. I'm actually speaking in 3 days at the Georgia State Capitol and I'm the keynote speaker there for Maternal Health Awareness Day. I've turned my 9-time pregnancy loss journey into an interactive case study. So lawmakers, doctors, other healthcare providers in the audience can actively choose the correct care option, but we know it's going to be the one, that's bad, that happened. But we're showing people in real time what it's like to be pregnant in the United States and the healthcare and the maternal health disparities that we're facing when pregnant.
Are you still nursing? Nursing. Are you still in? Are you still a nurse?
No, absolutely not. He stopped breastfeeding. You have to be careful with that. I
Are
was like,
you
no, he
still
stopped that
a
here.
nurse?
Yeah, so it's still nursing in a different capacity. I have another for-profit company that I started in 2020 after I got sick when I went to New York to help out in a pandemic. I started a nonprofit to help other small healthcare entities keep up with the recommendations for COVID. That has since turned from a COVID compliance company to just an overall healthcare compliance company. So I'm still nursing. I teach ACLS, BLS, all these life-saving certifications and compliance, but it's just a different type of nursing.
Okay. All righty. So I would not know. I thought your nonprofit was 3 or 4 years old. And
No,
even then, this growth would have been remarkable. But to hear it's just over a year old.
yes.
No, it's
It's,
not a year old.
it's not
October of
a year old.
2024.
October. That's how I'm here, I guess. So November, December, January. Yeah, it's just a little over 3 months old, actually. And
Yes.
that's how
Okay.
receptive the community is, right? Because that's
The
how
need is
big
there.
the need is. Being an entrepreneur is only solving an issue. The bigger the issue, the bigger the problem that you solve, the bigger the business. That's all
Okay.
it is.
What have you got coming up? What's
Uh,
next on your plate?
Goodness, a lot. So we're planning a Black Birther Expo that'll be happening next October. And very interactive. We're going to have virtual reality childbirth, so our partners can see what it's like to give birth to a baby, and you can experience firsthand if you're a first time mom. We have virtual reality maternal health therapy and all of these things. All of these things. We have a book release coming up. I'm currently working on my first book called Trauma Made Me Do It, and
Mm,
it's going to be amazing. I'm so excited about it. Amazing book to help you with exactly what I said, seeing resilience as the bare minimum, because growth is literally waiting on you if you're
right.
able to get into that growth mindset. So that's coming out this year. Um, we have so many events. We do a lot of caregiving. We send care baskets to nearby hospitals for high risk moms and their babies. We have events coming up. I'm speaking at many conferences this year. New York State Perinatal Association, Clinician Fest, just so many. So a lot of things coming. You can always check our website to see where we are. We stay busy and love to partner because this maternal health crisis takes a village. There's no
Ah,
one company, organization that can do it. I don't care how big it is.
right. Exactly. Exactly. Okay. A lot coming up for you, and I'll have all of your contact information and your platforms in the liner notes. So we are at the part of the podcast where I ask all of my guests the same thing. We are the Healing Words podcast. So I'm going to ask you the next 5 questions based on the first letter from the word words.
All right.
W. When did you know for sure that you were going to start this nonprofit? A light after nine. When did you know?
On my birthday, August 20th, I'm a Leo, yes. I was thinking about what I would really want for my birthday because people kept asking. And the answer is I want nobody to ever go through what I went through. And I gifted myself this nonprofit. This is
Oh,
literally my baby.
okay. Wonderful. Oh, obstacles. What obstacles did you have to overcome in the starting of this nonprofit? Were you working and you were doing it like before and after work? Did you have a hard time assembling a crew? What obstacles did you have to overcome?
So for business, like I said, I have the other business, so it's a lot juggling all of these things. And once I started that nonprofit, it literally took off. So it's just been a lot doing both of those things. But the biggest issue that I didn't think about that I would come across is like you was talking about telling my story for the first time. I had never spoken of all these parts and intricacies of my story until I started this nonprofit. And it was just a lot to cope with, reliving that story early, over and over early in this process to now being able to confidently talk about it and examine it and have these conversations.
Mm. Okay, R, rear view. Knowing what you know now, today, what would you tell yourself after that first pregnancy loss, and particularly after the twins one, because that's when you found out that there really was something going on.
Right.
What would you, in hindsight, what do you wish you'd known then?
In hindsight, I would have advocated after the first pregnancy loss just to do some basic testing, thyroid test, genetic testing, just to rule out those things so we know moving forward if this was to happen again, it's not those blood tests. Those were simple blood tests that could have been done. That was not done until right before pregnancy 6. That's insane. We could have been did that. So my doctors and my team already knew, well, it has to be something else. And then after the twin pregnancy, I wish I would have known about transabdominal cerclage because right after that pregnancy, I could have went to the doctor and got on that OR table. And instead of waiting until 13 weeks into a pregnancy to do this and then having to take it out before I go into labor and getting a transvaginal cerclage, I would have just got a transabdominal cerclage outside of pregnancy and I would
Oh,
have been
I want to back up to what you just said. One thing you look in the rear view, you would have had a blood test done after your first one, even though doctors are continually saying, "Hey, it's normal." This
right.
because I was told that
Mm-hmm.
this is normal. You're fine. It happens to a lot of women. Your next one will be okay, and then you have more after that. Are you're really advocating that after your first miscarriage, after a miscarriage, go and get testing done?
Right. Because these tests are simple blood tests. So there needs to be a change in the standard of care for infertility care and treatment and evaluation. A lot of times, or the rule of thumb, the gold standard is to have 3 losses before you're even diagnosed with cervical insufficiency. So you can't even receive the treatment until you lose 3 babies. And when they're coming up with this standard, are they saying this out loud? Because when I say that out loud, when I regurgitate that information, it's hard for me
To even
to
say that, that's a
say
man. That's a
that.
man coming up with that.
Gotta be. It gotta be. It gotta be.
Three?
You have to have 3. You have to lose 3 kids before we even see you. Before we even talk about next steps. Before we even consider IVF or whatever the case may be. And then before you even get the cervical cerclage. You know, we should have been checking my cervical links because that's another way to diagnose it. Those blood tests for genetic, abnormalities and causes for infertility, thyroid issues could cause infertility, autoimmune diseases could cause infertility. We could check that after the first one
Right,
just to see. Then early on, we know how to treat them moving forward.
right. Wow. Okay, D, delete. You're very open, very vulnerable, talking about your challenges.
Hmm.
And I know you've got books coming up.
Hmm.
Is there any part of your story you sometimes you think, oh no, that's a little too much. I don't need y'all getting in my business like that. Is it sometimes you're wondering, am I saying too much? Or the D is for delete. Are there some things that you're thinking whether you or not you should delete this part?
So my whole story is unfortunately way worse than
Mm.
the story that
So
I've
you've
told.
done your deletions.
I have, unfortunately. They won't be in the book. I haven't taken anything out in the book, and that's been another healing journey that I've had to go through, starting over, because I go from childhood to now. And if you knew everything, you know, this story alone is already traumatic for people even listening. You know, so if you knew everything, it you would know there are a lot of deletions. So
Wow. So it's one of those you don't look like what you've been through stories.
I hope not. Do you think I look cute? Is that what you're
You
saying?
do look cute.
I hope not, because you know, goodness, I probably look like I don't even know what I told or something.
Okay, so the S, strengthened. How has the founding and the operating of your nonprofit, how has that strengthened you?
Yeah, so I thought I had rested and I was this more healed because you're never healed, in my opinion. Your healing is a journey, a continuous journey. I thought I was at a level of healing that I really wasn't at until I started telling my story, which is a big part of my platform for my nonprofit, being a voice. Because infertility is taboo in our
Mm,
society. It's
mm,
embarrassing. We get shamed for it. You know, a big part of being a woman, according to society, is our ability to have kids and repopulate. And when that's threatened, it's very shameful for a lot of people. So, being vulnerable and telling my story is a big part of the platform. And that has given me a strength that I didn't know I had or needed to have. I knew it was hard to talk about. That's why I hadn't talked about it. But once I started repeatedly telling this story, I'm like, man, I've been through a lot. I'm stronger because of this. And it's empowering to be on the other side.
yes. And you get to the other side, not from not just being resilient, but going through it
Yes,
and knowing you will then grow up.
right. You have to have vision to see yourself greater than just being resilient. You have to have the motivation and the unwavering urge to be greater than resistance. And
Mm,
you have to have vulnerability to address the things that's holding you back and keeping you in the resistance phase. And then you have to have that mental strength to be able to know that you can do it because it gets rough. You know, you go back
yeah.
sometimes, you have your days, but you have to keep
Mhm.
pushing past that.
And I would say there has to be a time or two where you've grown that you could only see it in the rear view. You look
Mhm.
back and think, oh, I,
Yeah.
I, I've gotten past that. I didn't think. I don't think that thing anymore, or that thing right there doesn't trigger me anymore.
Yes.
Sometimes healing sneaks up on you.
It does. It does. I think sometimes we don't even know something is a trigger until it's a trigger, right? I think that's triggers, period. You just don't know until you hear a song, until you smell a scent. There's right under my desk, this box called Rachel's Gift. And like I knew I was further along when I was able to open this box that I was giving. It's a part of one of the hospitals that I stayed in after I had a loss. They give you this box. It's this company that just does something nice for those who have miscarriages. And in this box, I have this all of my ultrasounds. Like it's probably like 100 ultrasounds in here. But also they give you a blanket for your baby, and then they give you and which is in my baby's bed right now, uh, a teddy bear the size of your baby, whatever grams. And I used to always go into this box and just cry and just look through it and just boo-hoo. But now I can open it up and show other moms and talk about it and not shed a tear. So it was a marker that I had, to a checkpoint, if you will, to see how far along in my healing journey I was.
Amazing story. I'm looking so forward to having you back when you publish your book, because we can talk about that. Amazing story, and I'm still overwhelmed that this is not even a year old yet.
It's
And look at
not.
all the work.
I'm scared. I wonder
You're
what's.
doing more than thriving, ma'am. You're doing more than
Thank you.
thriving.
Thank you so much.
I want to thank you so much for stopping in and chatting with us today. I'm going to put your contact information all in our liner notes. And anyone out there, if you or someone else has maternal challenges and issues, maternal conception challenges and issues, please go to her website, get the help you need, and also look for some of the forums and some of the other things you'll be doing and speaking as well.
Yes, we
Excellent.
welcome.
Thank you so much, and we'll see you next time on the Healing Words podcast. Bye bye.